The ACL is the anterior cruciate ligament. It's one of four major ligaments in the knee that help provide stability. In particular, the ACL helps prevent the tibia from translating forward, the tibia being your shin bone. It also helps provide some rotational stability about the knee. It really comes into play, especially when athletes, when you're trying to do a cut or a pivot. If you have an ACL deficient knee, it becomes very difficult to do this because the knee is going to buckle. It's not going to support your weight. ACL injuries used to be very common or much more heard of in men. But with more females becoming involved in athletics, the injury rate in female patients has gone up tremendously. Anatomy is a little bit different between males and females, and in female patients, they've actually been predisposed to ACL injuries almost more so than some of the males, because inside the center of the knee, the way the femur is shaped, often in females it's a little bit tighter and doesn't give that ACL as much room to basically live, if you will. When a patient comes in with an ACL injury, oftentimes it's a clinical picture. You just determine the amount of instability that is present in the knee, and you need to counsel a patient. And there are a lot of factors that come into play, and should you reconstruct it or should you not? If an older patient, more sedentary lifestyle, more arthritis in the knee, a lot of times I'll treat that conservatively, and I would not recommend an ACL reconstruction. A younger athlete and they wish to get back to contact type sports or cutting and pivoting types of activities, it's very rare that they're able to get back to that high level of competition without reconstructing it, because the knee's just not going to support them when they go to make that cut or pivot. So typically those younger athletes almost always will get an ACL reconstruction. This is the center of the knee, and this is actually a torn anterior cruciate ligament. A healthy anterior cruciate ligament will run in this plane here and will actually attach to the bone. This one is actually torn off the bone up here and is very lax. And up here is actually the new graft that was passed to reconstruct this knee, and you can see how distinct these fibers are when compared to the ones down here, and it's running in a much more normal, or what we refer to as an anatomic position for a new graft. After an ACL reconstructive surgery, a patient can expect a good 4 to 6 months of rehab. The first few weeks you're working on getting the quad strength back, you're doing straight leg raises, and work on getting your motion back. I don't let my patients typically don't do any type of running or jogging for about 3 months. After 3 months you start getting back into jogging. Usually about 3 to 4 months I start working on agility drills, where you start working on that cutting and pivoting and working on that proprioception to understand where that leg is in space and time, so you can get back into your athletic activity that probably got you into the predicament to begin with. Most patients that have undergone ACL reconstructive surgery, I'd say probably upwards of 90% do well,